Long before pharmacy shelves were lined with artificial tears, people reached for honey to heal wounds, burns, and stubborn infections, relying on its natural antimicrobial and tissue-repairing properties. Now researchers in Madrid have pulled that ancient remedy into a modern surgical setting, asking whether Manuka honey eye drops could actually outperform the standard treatment given to patients recovering from cataract surgery. The answer turned out to be striking enough to draw serious scientific attention.
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at Mercola.com for the latest health insights.
Hello and welcome to Dr. Mercola's Cellular Wisdom.
It's a bigger question than it sounds because dry eye disease affects a large share of adults and an even greater proportion of older people. Cataract surgery has a reputation for restoring crisp vision, but Dr. Mercola points out that it frequently leaves patients with burning, gritty, watery eyes that struggle with reading, screens, and bright light. For many, that discomfort doesn't fade in days, it lingers for months, quietly interfering with everyday life.
And here's the problem with conventional care. Standard treatment leans on lubricating drops, steroids, and anti-inflammatory medications. Those add moisture, but they do little to repair the damaged surface of the eye that's actually driving the irritation. Manuka honey appears to behave differently. Rather than simply wetting the eye, it seems to address the underlying problem all at once, calming inflammation, supporting tissue repair, and protecting vulnerable tissue from microbial stress.
So how did they test that? The article describes a 2026 study published in Frontiers in Ophthalmology that followed 53 adults recovering from cataract surgery. One group used Manuka honey eye drops, the other used standard sodium hyaluronate artificial tears. Everyone used their assigned drops 4 times daily for 1 month after surgery, alongside their normal post-operative medications, while researchers tracked symptom severity, redness, tear stability, and visual function along the way.
What's fascinating is where each group started. The Manuka honey group actually began with significantly worse dry eye scores than the control group. Yet, by the 1-month mark, the situation completely reversed. On the Ocular Surface Disease Index, a questionnaire doctors use to measure how badly dry eye interferes with daily life, the Manuka group improved by an average of 27.3 points, while the sodium hyaluronate group improved by just 4.3 points. Researchers called that difference statistically significant, even after adjusting for sex and baseline symptoms.
That index covers exactly what people complain about: blurry vision, discomfort, light sensitivity, and trouble reading or using screens. A larger drop means symptoms became far less disruptive. The difference between constantly noticing eye irritation and barely thinking about it. The visible inflammation followed the same pattern. Patients using Manuka honey reduced the redness in the whites of their eyes below where they started, while the control group's redness actually increased after surgery.
The timing mattered too. Cataract surgery often triggers a surge of dry eye symptoms in the first several days, and in many patients that irritation drags on for months. But the Manuka group showed progressive improvement across the study, and the gap between the two groups grew more pronounced at 1 month. Not every measurement reached statistical significance. Tear breakup time, which measures how long tears stay evenly spread before drying, favored the honey group but didn't quite cross that threshold, though the direction still pointed toward a calmer, healthier surface.
So what's the mechanism? Dr. Mercola explains that Manuka honey carries natural antimicrobial compounds and unusually high levels of polyphenols, plant chemicals with antioxidant and anti-inflammatory effects. Researchers suggest it may lower the inflammatory molecules that rise during eye irritation, the same chemicals that damage tissue and trap the surface in a cycle of redness and discomfort.
It also appears to support physical healing. Researchers noted that Manuka honey may encourage the growth of fibroblasts and epithelial cells, the repair cells that rebuild damaged tissue after surgery. Think of fibroblasts as the body's construction crew, stabilizing tissue, while epithelial cells form the protective outer layer. Faster repair means fewer exposed nerve endings, less irritation, and a more stable tear film.
There's one safety point worth emphasizing, though. If you want to try this, use only sterile, ophthalmic-grade Manuka honey products formulated and tested for direct contact with the eye. Never reach for raw kitchen honey, because even high-quality table honey can carry bacterial and fungal spores that cause serious infection on the delicate surface of the eye.
And honey is just one piece of a bigger strategy. Dr. Mercola recommends lowering the environmental stress that evaporates your tears using the 20-20-20 rule, where every 20 minutes you look at something 20 feet away for at least 20 seconds and blink fully. He also suggests running humidifiers, redirecting any air that blows toward your face at night, and applying a warm compress over closed eyes once or twice daily to open the tiny oil glands lining the eyelids.
Nutrition ties directly in as well. Seed oils and ultra-processed foods fuel the kind of inflammation that damages your tear film, so the recommendation is to replace those with more stable fats like grass-fed butter, ghee, and tallow. Adequate protein matters, with about a third coming from collagen-rich sources, plus antioxidant-rich foods packed with lutein, zeaxanthin, astaxanthin, and vitamin C to protect the lens. Stable blood sugar counts too, since chronically elevated glucose can damage the proteins inside the lens.
What stands out is the shift in thinking from simply keeping the eye wet to calming the irritation and rebuilding the surface, which is exactly why this old folk remedy held up against modern drops. If you've battled scratchy, exhausted eyes after surgery or a long day on screens, the full article walks you through which honey product to look for, the daily habits that protect your tear film, and the foods that calm the inflammation behind chronic irritation. Read the complete step-by-step protocol at mer-cola.com and start protecting your vision today.
Thank you for listening to Dr. Mercola Cellular Wisdom. See you in the next episode.
Looking for trusted health wisdom you can hold in your hands? Discover the life-changing books of Dr. Mercola at joyhousepublishing.com. These titles bring decades of natural health research into practical steps for better energy, stronger immunity, and clearer thinking. Take charge of your health with guidance rooted in science and experience. Visit joyhousepublishing.com now and claim your bonuses while they are available.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.